Have you ever walked into a skilled nursing facility, aka nursing home, and seen multiple call lights on, patients out by their doors, and no staff around whatsoever? Well, I'm Julie Robertson, and I'm a registered nurse, and I'm going to talk to you why there is such a nursing shortage in the United States. So, according to the Bureau of Labor Statistics Employee Projections from 2016 to 2026, registered nurses is listed among the top occupations, and an RN is expected to grow from the 2.9 million to 3.4 million in 2026. But you may ask, why is there such a nursing shortage? So the ones that are affected primarily from the nursing shortage is the patients and their family, the nurses, and of course the nurses' aides. So we do have a growing problem. Nursing is the nation's largest healthcare profession with 3.4 million employed, yet we still can't seem to find enough nurses for skilled nursing facilities. So with our patients, they are the main reason that we do nursing. Many nurses decided to get into this profession primarily for our patients, and nurses are the front line for every patient. We are their advocates. We are the reason that they get the help that they need. All their care, all their needs are met. As the nurse to patient ratio decreases, nurses are under more pressure. This can mean that, for example, patients are not monitored as carefully as they should be. We do have an increased mortality and infection rate when you do have a shortage of nurses. So nursing homes, on the other hand, saw a striking 13% rise in the mortality among the ages 85 and older. In 2012, we had an issue on the American Journal of Infection Control, and with the high patient to nurse ratio, we have a lot more burnouts, which leads to increased urinary tract infections and other infections associated with it. A big issue with burnouts is that when you have a 30-to-1 ratio, meaning 30 patients and 1 nurse, and having to have a responsibility for all of them on top of your nurse's aides, it can get very hectic. I remember a time working where we had 2 call-ins from nurses' aides, and it was me and 1 other nurse's aide for 60 patients. Very unsafe, right? Well, when calling administration, it was thrown under the rug. So patient safety becomes a huge threat at this point. So what causes nursing shortages? Nursing schools struggle to expand their capacity to meet the needs for care and often turn away qualified applicants. We also have nurses that are starting to reach retirement, and nurses who work in a culture of bullying experience job dissatisfaction, which in turn leads to increased rates of sick leave, nurse attrition, and decreased workplace productivity, satisfaction, and morale. And I actually do have somebody here with me who is a nurse's aide. So from getting my perspective as a nurse, I would like to get her perspective as a nurse's aide as far as what kind of bullying made her essentially quit her job. So welcome up, Kendall.
Hello, my name is Kendall Lejoie. I worked at Skilled as a nurse's aide, and the issue that I had was a supervisor. It was me and a supervisor attending only on second shift. There was a resident sitting in her wheelchair, voided from the waist down, and I asked the supervisor if she could help me with her. She told me no because she was too busy doing supervisor paperwork, and that comes first before the residents. Therefore, that night I put in my 2 weeks.
Thank you very much, Kendall. So as you can see, we do have a lot of workplace bullying that attributes to nurses leaving their jobs. And what can be done to fix this issue? Nurses often fear reporting the bullying due to the fact that they could have retaliation, which in return it really does happen. More in-services, so that you're not exactly pointing out a specific person, but you're talking to everyone in general. We could do longer orientations. disciplinary actions, holding our staff accountable, and using more LPNs in the nurse. Thank you very much.